Good morning, everyone. This is Dr. Jaya Sonkar from JSR Health Rheumatology. Disclaimer, whatever I'm going to talk about today does not replace your medical office visit. Please continue to follow up with your primary doctor and your rheumatologist. Today we are going to talk about positive ANA, which is a very common finding in normal population. About sometimes 10 to 30% of the population, depending on where we are, can have a positive ANA. What does that mean? It means that we have our body and we have our army, which is our immunity that fights the infections and that fights the cancers. Sometimes it can get confused and turn around our own body and start creating some problems. So it can start creating certain antibodies, thinking that our own body is a problem. Now, does it always cause a disease? Not necessarily. You can have a positive ANA and not have a disease. You can have a negative ANA and yet have a disease. So it has to be a detailed evaluation with the symptoms, with your lab findings, and multiple things taken into consideration before you get that diagnosis. However, when you have a positive ANA, what could be the reason, right? There can be many reasons. One can be maybe you have a family member who has an autoimmune disease and you just inherited that tendency to create those kind of antibodies. Maybe they will stay dormant, maybe they can start acting out. Depends. Certain medications, certain infections, very simple as common viral infections, can also give rise to a positive ANA. So, what do we do when we have a positive ANA? Don't worry, just go ahead and talk to your primary doctor, or if you need to talk to a rheumatologist, discuss your findings, discuss your symptoms. Normally, 1 is to 40 and 1 is to 80 ratio are low levels and they are just borderline, but when it comes to 1 is to 160 or above, it should definitely be checked. There are certain types of other antibodies that can be checked if you have a positive ANA, like you can be checked for lupus, which is dsDNA, Smith, chromatin sometimes, or Sjogren's, which is SSA/SSB, or you could also get checked for antiphospholipid antibodies. And then there are more like scleroderma, centromere, depending on what the symptoms are. If you have muscle cramps and all, you can also be checked for myositis. And then there are many, many more. Because autoimmune diseases are not limited to the rheumatological world. They can also be autoimmune liver disease, autoimmune neurological disease, and autoimmune skin disease, and many, many more. So if you do have a symptom, please follow up with your primary doctor. If needed, see the rheumatologist, and depending on what your antibodies are and what your clinical symptoms are, see the relevant specialties as well. If you have any question, or if you have any concerns, or if you have a positive ANA and you're looking for answers and you would like to schedule an appointment, please call us at 832-295-9186. Again, 832-295-9186. We are located at Cyprus and we'll be happy to take care of you. Have a good rest of the day. Bye-bye.